Hi, Mrs. Drent. This is my audience.
Hi.
Everyone in this audience today all has something in common. We are alive, and we have all been given the chance to live. Today in this speech, I will tell you about millions of lives that do not have the chance to live, like we do. This speech is on abortion, and I will tell you how abortion is inhumane. Abortion is inhumane because it is a painful medical procedure. It is killing a human being, and it hurts the mother. First off, abortion is a painful medical procedure that a woman has to go through if you want an abortion. Abortion is the intentional termination of a pregnancy after conception. It allows women to put an end to their pregnancies, but involves killing the undeveloped embryo or fetus. There are many procedures, but the main three are suction aspiration, salt poisoning, and hysterectomy. Which procedure you use depends on the stage of pregnancy and size of the unborn child. The suction aspiration is the most common method of abortion during the first 12 weeks of pregnancy. The general or local anesthesia is given to the mother and her cervix is quickly dilated. A suction curette, which is a hollow tube with a knife-edged tip, is inserted into the womb. The instrument is then connected to a vacuum machine by a transparent tube. This vacuum suction is 29 times more powerful than a household vacuum cleaner. The vacuum suction tears the fetus and placenta into small pieces, which are sucked through the tube into a bottle and thrown out. There is a similar method to this one, the dilation and curettage. This method cuts the baby into pieces. The pieces are scraped out through the cervix and thrown out. Another abortion method is salt poisoning, also known as saline injection. This method is used after 16 weeks. A long needle injects a strong salt solution through the mother's abdomen into the baby's sac. The baby swallows this fluid and is poisoned by it. It also burns off the outer layer of skin. It takes somewhat over an hour for the baby to die from this. Within 24 hours, labor will usually set in, and the mother will give birth to a dead or dying baby. The last method that I will talk about is hysterectomy, otherwise called cesarean section. This method is used in the last 3 months of pregnancy. The womb is entered by surgery through the wall of the abdomen. The technique is similar to a cesarean delivery, except that the umbilical cord is usually cut while the baby is still in the womb, which cutting off his oxygen supply and causing him to suffocate. Sometimes the baby is removed alive and simply left in a corner to die of neglect or exposure. This information is from all. Second, abortion kills a human being. Abortion has been legal in every U.S. state since 1973, when the Supreme Court ruled in Roe Wade that women have the right to make medical decisions about their own bodies. Abortions have been performed for at least 3,500 years. Here is how it goes for the pregnancy from 8 weeks to 40 weeks. At 8 to 9 weeks, the eyelids have begun forming the hair, and the hair appears. By the 9th and 10th weeks, the preborn child sucks her thumb, turns somersaults, jumps, can squint to close out light, frown, swallow, and move its tongue. The end of the 3rd month, all arteries are present, including the coronary vessels of the heart. Blood is circulating through these vessels to all body parts. The heartbeat ranges during this fetal period from 110 to 160 beats per minute. All blood cells are produced by the liver and spleen, a job soon taken over by the bone marrow. White blood cells, important for immunity, are formed in the lymph nodes and thymus. Vocal cords are complete, and the child can and does sometimes cry silently. The brain is fully formed, and the child can feel pain. The fetus may even suck its thumb. The eyelids now cover the eyes and will remain shut until the 7th month to protect the delicate optical nerve fibers. At 14 weeks, muscles lengthen and become organized. The mother will soon start feeling the first flutters of the baby kicking and moving inside. At 15 weeks, the fetus has an adult's taste buds and may be able to savor the mother's meals. At 16 weeks, 5.5 inches tall and only 6 ounces in weight, eyebrows, eyelashes, and fine hair appear. The child can grasp with its hands, kick, or even somersault. The fetus is now about 5 inches long. The child blinks, grasps, and moves its mouth. Hair grows on the head and body. At 20 weeks, the child can hear and recognize mother's voice. Though still small and fragile, the baby is growing rapidly and can possibly survive if born at this stage. Fingernails and fingerprints appear. Sex organs are visible, which, using an ultrasound device, the doctor can tell if the child is a boy or a girl. At 6 months, the unborn child is covered with a fine, downy hair. Its tender skin is protected by a waxy substance called vernix. Some of this substance may still be on the child's skin at birth, at which time it will be quickly absorbed. The child practices breathing by inhaling ammonic fluid into developing lungs. For several months, the umbilical cord has been the baby's lifeline to the mother. Nourishment is transferred from the mother's blood through the placenta and into the umbilical cord to the fetus. If the mother ingests any toxic substances, such as drugs or alcohol, the baby receives these as well. At 32 weeks, the fetus sleeps 90 to 95% of the day and sometimes experiences REM sleep, which indicates dreaming. At birth, the placenta will detach from the side of the uterus and the umbilical cord will cease working as the child takes its first breaths of air. The child's breathing trigger changes in the structure of heart and bypass arteries, which will force blood to now travel through the lungs. This information is from Abortion Access. Thirdly, not only does it hurt the baby, but it hurts the mother physically and mentally. Not many people, when getting an abortion, will think about themselves, about how it will affect their lives too. Abortion can hurt a woman physically. Abortion will increase the rate of breast cancer, placenta previa, preterm birth, and maternal suicide. A woman who has an abortion increases their risk at breast cancer. Placenta previa is a misplace of the placenta. Many abortions tie with mental problems. It could cause sexual dysfunction, unexpected guilt, child abuse and neglect, and an increase of alcohol and drug abuse. You may not think at the time of the abortion, but this innocent baby you are killing can feel anything and everything. This information is from the Enter for Bioethical Reform. So in conclusion, should an unborn child be killed for something that it didn't do? No. These babies are human beings just like you and I. A mother today cannot kill her child that is born. It would be considered murder, illegal. And so why is it okay to kill a baby in the womb? It is not okay. It is a woman's choice to have sex, and she must deal with the consequences that come from it. I hope that I have persuaded you that abortion is inhumane. Abortion is a painful medical procedure. Abortion is killing a human being, and abortion will, without a doubt, hurt you in the long run.